Ever since the coronavirus outbreak began, the big question here in India has been around testing. Whenever people talk about the fact that India has 4,000 cases, but it's also only 4,000 cases for a country this size, many people put out the question about, are we testing enough people? Well, if you take a look at the statistics that are actually happening, by now testing has gone up. If you look at what the ICMR has been putting out, something like 11,000 people were tested day before yesterday, something like 9,000 yesterday. And the number of people who are turning out to be positive with 11,000 and 9,000 were about 500 people or 300 people, as the case might be. So the number of people who are actually being tested who are turning out to be positive is not a very high number. It's about 4% or 5% or thereabouts. So that is a slightly encouraging sign that we should keep in mind. But in any case, testing has to be rolled out far more rapidly. Everyone agrees on that. And now another major innovation is coming in, which is rapid antibody testing. Now, what does that mean? It's not quite as precise as the present test, but if you are actually going into a containment area and you're wanting to test a lot more people, there's no point in just doing that sort of thermal scanning that we were doing and testing their temperatures. Instead, what is actually going to happen now is that people are going to be tested for their antibodies. So the protocols for that have been released, and how it works will also be released. So hopefully a few days from now, as the rapid antibody testing starts, especially in hotspots and places that need to be contained, we will start getting a much clearer indication of what the actual infection rates are. It is possible that the antibody testing will throw up some people who may have had the coronavirus and then have recovered, which may also be indicative of the fact that maybe they are asymptomatic infections that are taking place. So you get the coronavirus, you don't even tell about it, you don't get nothing bad really happens to you. All of that will also start to be shown up once antibody testing starts. Also, very interestingly, the first of the private players, Dr. Dant, has started drive-through testing. But let's just show you some of the latest information around testing and all the other coronavirus-related news.
The Union Cabinet has approved an ordinance slashing the pension and allowances of MPs by 30% for a year, Union Minister Prakash Javadekar said on Monday. The Ordinance and Amendment to Members of Parliament Act 1954 will reduce the allowances and pension by 30% with effect from April 1st, 2020. Javadekar said, apart from the ordinance on salaries of MPs, the Prime Minister, President Ramnath Kovind, Vice President Venkaiah Naidu and many state governors and lieutenant governors have also voluntarily decided to take a pay cut as a social responsibility. The money will go to the Consolidated Fund of India, which is the term used for the total revenue collected by the government through taxes and expenses incurred in the form of borrowings and loans. The minister also informed the media that the MPLAD fund has been discontinued till 2022.
Nationalist Congress Party Chief Sharad Pawar has said that authorities in Delhi should not have given permission to the Tablighi Jamaat for holding an international congregation at Nizamuddin between March 13th and 15th. Interacting with the people during a Facebook live chat, Pawar said Maharashtra, where the NCP is in the ruling alliance along with the Shiv Sena and the Congress, had denied Jamaat permission for an event. The senior opposition leader said India wouldn't have experienced a spike in Covid-19 positive cases if the permission to hold the international congregation was denied to Jamaat.
Superstar turned politician Haasan has slammed the nationwide lockdown as ill-planned. In a strongly worded letter to Prime Minister Narendra Modi, Haasan has questioned the central government's action, slamming it for the misery of the poor. Haasan also stated that mistakes of demonetisation are being repeated on a larger scale in the ill-conceived lockdown to fight coronavirus. He also trashed the government for organising light and sound shows while ignoring the plight of the poor.
Soon after BJP MP Gautam Gambhir pledged to donate ₹1 crore to the Delhi government, Chief Minister Arvind Kejriwal said the availability of PPE kits and not money was the issue, as he urged the former cricketer to help in getting these kits. Gambhir on Monday wrote to Kejriwal that he will give additional ₹50 lakh, apart from the equal amount he promised to a few days back for procurement of medical equipment and treatment of COVID-19 patients in the national capital. Meanwhile, with just few PPE kits left in hospitals in Delhi, the city government has written to centre and has also allowed hospitals to procure the kits from local manufacturers and suppliers, a report said.
In a bid to scale up testing facilities, a private laboratory in Delhi has started India's first drive-through testing facility for Covid-19. Located in Punjabi Bagh, Dr. Dang's lab stated that every test would take around 20 minutes and will be conducted only on prior appointment that can be booked online. It's mandatory for those getting tested to have a doctor's prescription. Priced on similar lines as the government-approved test, each car will be required to maintain a 30-meter distance from another. The facility, divided into 4 stations, has the capacity to test 30 to 50 patients a day. Taxis and two-wheelers, however, are not permitted.
Dr. Randeep Guleria, the director of All India Institute of Medical Sciences in New Delhi, has said the novel coronavirus outbreak in India has reached the community transmission stage or stage 3 in some parts of the country. Speaking to India Today, Dr. Guleria, who is part of the highest panel formed by the government to deal with Covid-19, said India is still between stage 2, which is local transmission, and stage 3, and some hotspots in the country were seeing localized community spread.
Tamil Nadu Chief Minister K. Palaniswamy on Monday said order has been placed for buying 1 lakh rapid test kits from China, and it will arrive on April 9th and will aid in quick screening for coronavirus in the state. Of the 4,612 people who were tested for the contagion, 571 have turned positive in the southern state. Rapid test kits will be sent to all districts and testing could be done quickly for whomever needed, the Chief Minister said. The kits have a 30-minute window for providing results, which will aid quick and more screening of people to ascertain the presence of virus.
Wockhardt Hospital in Mumbai, one of the Covid-19 hotspots in India listed by the government, has been shut and declared a containment zone after 3 doctors and 26 nurses tested positive for coronavirus in a span of 1 week. The administration has barred the entry and exit from the hospital until all patients test negative twice consecutively. Swab samples of more than 270 hospital staff and some patients have been sent for tests. Meanwhile, the hospital's canteen remains functional and will provide food to the staff and patients, but an officer and 2 constables have been posted to restrict movement.
All zoos in India have been asked to remain on high alert and monitor animals for any abnormal behavior after a tiger at the Bronx Zoo in New York tested positive for the coronavirus. Zoos have also been asked to send samples of suspect animals to animal health institutes to initiate testing. The Central Zoo Authority of India issued an advisory on Monday. The advisory has asked zookeepers and handlers not to go close to the animals without safety gear and have the least contact while feeding them. There are around 160 recognized zoos in India with more than 56,800 captive animals. All zoos are presently closed because of the 21-day nationwide lockdown that began on March 25th.
The Life Insurance Council of India has announced that all life insurance companies, both public and private, will process all coronavirus-related death claims at the earliest. According to a press release from the Life Insurance Council, the clause of force majeure will not apply in the case of COVID-19 death claims. Apart from this, the IRDAI has also provided additional time for the payment of renewal premiums in case of health insurance policies and motor third-party insurance.
Spain saw a 4th consecutive daily drop in the number of coronavirus-related deaths, with 637 fatalities recorded over the past 24 hours. The Health Ministry said the Sunday toll, which is the lowest in 13 days, brought the total number of deaths to 13,055. The number of new infections also slowed, rising 3.3% to 135,032, down from a 4.8% the day before.
South Korea recorded fewer than 50 new coronavirus cases on Monday, marking the lowest number since late February. The development comes as the nation extended strict guidelines on social distancing. South Korea has recorded around 100 or fewer daily new cases for more than 3 weeks. But health authorities remain on high alert over cluster infections at churches and hospitals, as well as new cases coming from overseas. The 47 new cases detected on Sunday and down from 81 cases a day earlier brought the nation's total infections to 10,284.